Today, I'm talking about the number one sign that your period is hurting your fertility, and no, it's not cramps. We've been told that painful periods are normal, that we should just take some ibuprofen and just get on with it. They're not normal. They're common. The cramps themselves, they aren't even the most important sign that your period is giving you. The number one sign that your period is telling you something is very wrong with your fertility health is the color and the consistency of your blood. If you see dark, purple, clotty blood, your body is screaming at you. It's screaming blood stasis. In this video, I'm going to show you what your period should look like, what these different colors mean, and what it's telling you about your ability to conceive. Hi there, I'm Dr. Gina Terinoni, and I'm a doctor in traditional Chinese medicine for over 25 years. I've helped over 2,000 women and couples to become pregnant. I'm also a certified integrative medicine practitioner. Welcome to day 2 of our 30-day fertility challenge. Yesterday, we talked about the cold womb pattern. If you haven't seen that, then go over there after you watch this video. Today, we're talking about the stuck garden pattern. It's blood stasis. Your menstrual cycle is your monthly fertility report card. That's why it's amazing. It gives you a direct visual update on the health of your reproductive system. But most of us were never taught how to read it. And by the end of this video, you will be able to. And if you're just joining me, make sure that you subscribe and hit the bell below so you can follow along for all 30 days. This is crucial information that you're not going to get from your regular doctor. Let's dive in. So, what does a perfectly healthy period look like from a Chinese medicine perspective? This is what we want to look at. We want to make sure that the color of the blood, it's bright and it's fresh red. A little bit like cranberry juice, not old wine, not brown, not purplish. Consistency of the blood should be a smooth flow, no or very minimal clots, like if stringy is okay, or just a very small, under raisin size, nothing like this big, or some women have really big clots. That is not okay. The pain should be minimal to no pain, and you should be aware of it, but not debilitated by it. And very little, if any, low back sensitivity or lower abdominal area. And the length is roughly 4 to 5 days of flow. And the length of the cycle, it doesn't have to be 28 days. What's normal for you? Maybe you've always had a 27 or a 30 day, somewhere in that range. And this is something, feel free to drop below. It's always a big conversation, and I'm happy to help you decipher what your body's telling you. So let's talk about the most common deviation from this, and this is called blood stasis. I see this pattern all the time. I came up with, after studying Chinese medicine and working with specializing women's health for over 25 years, I have 6 primary fertility patterns, and all of them have different menstrual cycles. So blood stasis is exactly what it sounds like. Your blood is not flowing smoothly. It's getting stuck. It's congealing. It's moving slowly and inefficiently through your uterus and your entire pelvic cavity. So when blood sits around for too long, it doesn't move, it gets old. It oxidizes, it turns dark. It can turn dark brown, it can turn purple. Think of a cut on your finger, fresh blood, red blood. That's what we want to see. But an old scab, it's dark, it's brown, doesn't have much energy. This is a similar principle. So when you see this on your period, it's a major sign of blood stasis, and it is not something to be overlooked. So here are the signs: dark purple or brownish blood, large stringy clots, fixed stabbing pain, And this is different from dull, achy pain. Dull, achy pain is usually related to a cold pattern, but stasis pain, this is sharp, it's localized, it hurts. It often causes women to call out of school or work, or they cancel plans. So also, there's pain that feels better after passing a clot. This is a classic sign. This pattern, it's incredibly common in conditions like endometriosis, uterine fibroids, and ovarian cysts. These are all, at their core, manifestations of blood stasis. We call things a little bit differently, but they're the same. We can understand this from a Western medicine concept. So how does this affect your fertility if you've got blood stasis? In two major ways. First, just like we talked about yesterday, if blood flow is poor, your eggs are not getting the oxygen and the nutrients that they need to flourish. Stagnant blood is deoxygenated blood. It's not nourishing the follicles at all. Second, and this is critical, blood stasis creates an inhospitable environment for implantation. Your uterine lining, the endometrium, this needs to be lush, vibrant, blood-rich. It needs to be a blood-rich home or womb for an embryo to implant. If your lining is built from old, stagnant, oxygen-poor blood, it's like trying to plant a seed in a compacted, dry, unhealthy soil. The embryo can't attach and grow. Breaking up the stagnation and invigorating blood flow, this is one of the absolutely most important things we can do to improve fertility for a woman who has blood stasis, especially for anybody with painful periods or a diagnosis like endometriosis. This is the absolute primary focus of my warm womb method that I created. It is a simple, complete, entire 14-day protocol that I designed to get things moving again. And we use the specific warming foods that promote circulation. We use castor oil packs to break up local congestion. And we use a targeted acupressure routine to move blood stasis in the pelvis. And when my clients do this protocol, the first thing they notice is that their next period is already improving. The blood is brighter, it's less painful, and they have way fewer clots. And that's how we know it's working. It's not a mystery. You'll start to feel better pretty quickly. So if what I've described today sounds like your period, I strongly encourage you to take my free fertility pattern quiz. It will help you confirm if blood stasis is your primary issue or if it's combined with a cold pattern. And this will guide you to my warm womb method. The link's in the description. If you come up with another pattern or you're not sure, I have an egg quality method course. It's very extensive. It includes 2 assessments. One is an assessment that helps you determine which of the 6 fertility patterns that are most common, because we can't treat and work with everybody the same. It's dangerous to do that, or it's inefficient and it's not productive, and it won't help you to get pregnant unless you personalize and focus on the red flags that pop up from that quiz or that assessment. Your body is talking to you every single month. That's fortunate that we have this information that we can take and personalize health plans with. It's time that we learn your body's language. Now, I want to hear from you without getting too graphic. Have you noticed clots? Or what color is your flow? Or do you have a lot of pain? Do you get migraines? Do you get headaches? How's your digestion? Like, what happens to you when you get your flow? And some women also will get pain during ovulation. So what are your key symptoms that you see? Let's talk about it in the comments, and I will read every single comment. So you are not alone in this, and acknowledging that this is not a quote unquote normal, but maybe it's a common experience with a menstrual cycle. This is the first step. So thank you so much for being here for day 2. Go back and watch day 1 if you missed it. Tomorrow, day 3, we're going to tackle a big one. Why the diagnosis of unexplained infertility is a total myth. You don't want to miss it. I will see you then.